Let's talk about hand, foot, and mouth disease in youngsters.
I ain't gonna lie, when I heard hand, mouth, and foot, I thought, is this cows? Is this for cows?
Foot and mouth. No.
We just want our listeners to know that this condition is different from the foot and mouth that we've always known. That affects cattle and other poultry. Hand, foot, and mouth. This is a viral infection that it can affect everyone, but it's more common in kids. It's more common in kids. It's usually not a life-threatening condition. It's a condition that we usually treat symptomatically because normally it's a self-limited condition. By self-limited, we are saying if you have it today, it can just recover by itself without giving you any meds.
No treatments.
No treatments are necessarily required. But when we treat, we are just treating the symptoms because you can have itchiness, you can have pain from the blisters and the rash that you can develop on the hands, on the feet, and also sometimes on the buttock, the groin, and also the mouth ulcers. So we treat symptomatically by painkillers, sometimes by ointment to help the rash as well. It's a viral infection. So remember when we talk about flu, at some point we talked about chicken pox. These are viral infections. When we talk about flu, people say after 3 to 7 days you can recover from a flu. So the hand, foot, and mouth is also caused by a viral infection. The commonest is what we call the coccidiosis virus, and then the enterovirus, and it's transmitted through various modes and method, which is why it's very contagious. Remember, there are certain conditions that we know that they are transmitted by contact.
Yes.
Some they are transmitted by droplet spread, like flus and TBs. Some through the fecal-oral route if you get in contact with the stool from the person that is infected by such a condition. But when we talk about hand, foot, and mouth disease, it can be transmitted through all these modes, which is why it becomes a very contagious disease. There are certain complications that can happen from the hand, foot, and mouth disease, but I would want to mention that it's not very common for us to have complicated cases. So the complications, which are very rare, they can have meningitis, encephalitis, when the virus is now affecting the CNS. But also from the rash and the blisters, they can also become infected, and then you can get a superimposed bacterial infection. But it's very rare for us to encounter complications. But it is very important for us to identify this condition so that we can isolate these kids to pull them away from school so that they don't continue spreading. It usually comes about 3 to 7 days after the onset of symptoms. The initial symptoms is a mild fever, general feeling of malaise. The child is just not feeling well. Sometimes they can have a sore throat. But these are symptoms that can appear just from a flu or any other infection. So typically they will notice the rash, but the rash usually comes 3 to 7 days. Usually, and they are usually contagious even before onset of symptoms. So 3 to 4 days before onset of symptoms, they are already contagious. So, and they can also be contagious in the first week. From the onset of symptoms, but the striking issue about these hand, foot, and mouth diseases, they can remain contagious for months.
Really?
Even after they have recovered from the illness, which is why it is a very contagious condition.
So how do we manage that? Now that we know that you could recover from it, but you're still contagious. People are still going to school. So we've treated Baby Rose, but Baby Rose is okay, but it's still contagious. How do we then manage that situation?
So the highest chance of spreading is a week before onset of symptoms, and then the first week from onset of symptoms. So when you say it can remain contagious, they can remain contagious for up to a month or so after the onset of symptoms. The chances are very slim. The incidence is very slim. But so there's nothing that we can do about it. After someone is recovered from the illness, they also need to get reintegrated into schools, into daycare. But we are saying the chances of them being infective after a week from onset of symptoms is very, very minimal. But there are certain things that we can do to try and minimize the risk of getting infected. Keep maintaining good self-hygiene, washing hands after contact, before before and after using the toilet, before touching food, and also making sure that the surfaces are clean. Because if the virus is in contact with different utensils at home or even surfaces, if you get in contact with these surfaces, you can also contract the virus. So we need to maintain good self-hygiene, washing hands, disinfecting surfaces, and also just making sure that if someone has this condition, they are isolated.
Okay.
At least a week after onset of symptoms.
Yeah.
Because remember, I was saying it's mostly contagious just before onset.
Yes.
And for up to a week after onset of symptoms.
So after a week, you should be okay.
You should
go back to school.
You should be okay.
It's official. As of the 27th of November at 8:33, I'm not handling anybody's children.
So somebody asking a
So,
very
so can you
pertinent
get?
question
So can
here.
you get it as adults?
Yes,
you
you
said
can.
you
You
said
can.
the risks are low.
It's more common in kids.
Kids,
Yeah.
yes.
But if your kid has it,
And this
we isolate the kid. We say "Mwana ngaende kunogara kumba," and who's there at home? Other kids and the parents. And the rash is more itchy in adults as compared to kids.